Welcome to the 63rd installment of Ear to the Ground, the Land Stewardship Project's audio podcast on family farming, sustainable agriculture, local food systems, and local democracy. I'm Brian DeVore, editor of the Land Stewardship Letter. There's little doubt that America's healthcare system is in crises. Whether measured in per capita cost or percentage of gross domestic product, the U.S. market-based and corporate-controlled healthcare system is by far the most expensive in the world. Shockingly, that expensive and profitable industry delivers poor health care when ranked with other industrialized nations. Among those industrialized countries, the highest infant mortality rate is in the United States, and we rank the lowest in patient safety, access to health care, timeliness of care, and life expectancy. Farmers and ranchers, among the most independent of self-employed people, have been struggling along with the rest of our nation's citizens to pay high premiums and out-of-pocket expenses for health care. A recent report, based on a healthcare survey of farmers and ranchers in several Midwestern states, found that while 90% of the more than 2,000 farmers and ranchers surveyed said they had some sort of healthcare coverage, nearly a quarter of them said the cost of healthcare was causing them financial problems. More than a third of the farmers and ranchers in the survey said they bought their own insurance. These farmers and ranchers are especially vulnerable because they are often forced to buy insurance on the individual, non-group market, where insurance costs more and often covers less. The lack of affordable health care severely impacts the viability of family farms in many ways. It often forces one or both spouses to obtain off-farm work, which impedes the ability of the family to devote full attention and resources to the farming operation. This can often mean that farm families abandon their livestock operations, for example, because such enterprises require consistent on-the-farm management. The lack of health care also restricts the ability of young people to get started farming and deters people wishing to make a midlife career change and get back into agriculture. The Land Stewardship Project has recently launched a healthcare task force to examine strategies on developing a fair system of affordable healthcare in rural areas. During a recent LSP meeting in southeast Minnesota, I talked to three people, a farmer, a nursing student, and a rural resident, about their struggles with affordable healthcare. As you can hear, lack of affordable healthcare has become a problem for rural people from all walks of life.
I'm Kurt Twite from Byron, Minnesota. In the early 80s, when the farm crisis came upon, my wife and I had to face some tough decisions whether where we were going to cut costs. And the health care costs were there. They were multiplying quite highly. So we decided to give up our health care, and we literally, for 18 years, walked a tightrope. We tried to live a very healthy lifestyle. Although we had some health issues that we tried to deal with them and the best we could. And then one Sunday morning, I was fixing a TMR mixer and with my cousin, and boom. I looked down and there's 3 fingers missing on my left hand. And the first thought that came to my mind was, what am I going to do now? 60 cows to milk? How am I going to be able to do it? But we headed to the hospital, and the doctors did a marvelous job, and we were able to, over some time with some credit help from the doctors, to pay off the bill, and we've gone there, and it's been tough, and I really feel for the young farmers that are trying to start out in a very capital intensive business, particularly if they're in the animal business. It's really, really difficult to put all the pieces together. It's very troubling for me to see these young people that have to put a spouse in a job in town that has health insurance for their families to keep moving on. There's got to be a better way. I don't know what it is, but I think that if we as farmers and business people and just people in general put our heads together, we can come up with some sort of a solution. We've been kind of run by give it to us, and I had health insurance through a job for years, and I took it for granted. But then sometimes things change. It's troubling for me, and it was troubling for my wife.
One thing, Kurt, that I think a kind of a point that's come out in some of these meetings is that for farmers who particularly want to do livestock, it's very difficult because both spouses can't be on the farm, and so you can't be as close of a manager type of situation. Like with dairy farming, I would think that'd be very important. And you're mentoring a young farmer now, and I was wondering if you're kind of seeing that, how important that is, that they don't have to worry about their health care.
The young farmer that I'm mentoring now, his wife works off on the farm and has a family plan, and he had an accident with his eye, and that plan has really saved them. But by the same token, sometimes when a wife works away from the farm and gets away from the actual everyday function of the farm, she loses the appreciation that the husband has to have, the dedication that he has to put forth, the time he has to put in, and that can also create problems in the family. It's very important for farmers, particularly dairy farmers, that the husband and wife can be very supportive of each other. It's just I'm just basing that on my own background. My wife was very supportive of me, and actually she did the books and took care of the calves, and I hated calves, so. I didn't hate them, but it was always the last thing of the day that you had to do, and they'd slop milk all over you, and my wife had more patience than I had.
Well, that's good.
My name is Katie Wera, and I'm a Winona State nursing student who I'm a member of Take Action Minnesota, so I got involved with healthcare reform through that avenue.
Well, I was wondering if you could talk a little bit about, I guess you've seen the healthcare issue from a couple of sides. One is as someone who needs healthcare, obviously, but also as a nursing student. But you had talked a little bit about, you had kind of had a bad situation where you had a pre-existing condition, and, I assume you're a relatively young person. How old are you? 27. So, a lot of times people think of healthcare problems with older folks. So that's, yeah. So I was wondering, you could just talk a little bit about that situation that you'd run into already at the age of 27.
When I graduated from Minnesota State University Mankato, I obtained a job that did not have health insurance. So I went searching for that individual plan and ended up settling on Blue Cross Blue Shield, thought it was a good plan for catastrophic insurance, applied twice and was denied twice because of a pre-existing condition of hypertension. And then the third time I decided, I'm going to get everything in a row and try and do this one more time because it's pretty discouraging. Got an insurance agent, copied my medical files, and sent that off with my application. They agreed, but under conditions. So that first year that they would cover me, any cardiac or hypertension complication or exacerbation would not be covered, and it would not go through to my deductible. So that's my story with my health insurance. And
unfortunately, that's such a common story. I mean, we heard a lot of similar stories like that tonight. As a nursing student, I don't know, have you thought about, as you go into this healthcare field, is that a little bit discouraging to kind of see what's going on?
Yeah, we're, as a system, they're treating at a tertiary level and even a secondary level if they are diagnosing and screening for things. But we need to kind of take that triangle and have that primary prevention at the base and really focus on that and the education piece of it before the disease even occurs. But we are waiting until it's so critical because we just can't afford to go in and have health care.
Do you find a lot of a lot of your friends are similar age, are in similar situations?
Right now with Winona State, because I am the non-traditional student, so I'm the oldest in my group, they're still under their parents' insurance. So the first time I went through college, yes, I had my parents' insurance, but then once you graduate that first time, you just kind of get off that. And so I think right now I'm kind of the single person in my group, but there are other groups on either side of me that could have that going on.
My name is Kay Hulskamp, and I'm from Lewiston, Minnesota. We're going to go back a ways, back to 1996. Does anybody here remember Randall Foods? Okay, my husband was employed by Randall's for 26 years. We read in the newspaper that it was closing in 8 days. 26 years, and then they closed their doors. And at the time that he worked at Randall's, we had paid health, dental, and optical. Then we had to go out on the market because he became self-employed and find insurance that was affordable. Our first year that we purchased it, we paid $5,700 for the whole year with a $1,000 deductible. By the time we discontinued that policy, we would have paid $16,387 a year with the $1,000 deductible, and that was just in 5 years. So we switched to a different policy where our premium was $308 a year, or $308 a month, but our deductible went to $3,600. Now, within 4 years, our premium has gone to $673, and our deductible has gone up to $4,600. So our fear is that if we double again in 4 years, and the deductible keeps going up, that we won't be able to afford health insurance anymore. And we are in our 50s, and that's a scary prospect for us because we've always had health insurance. But we also are people who, because the deductible is so high, you don't want to use it unless something catastrophic happens. Friends and neighbors are all, I don't think I know anybody who is not struggling with the health care issue because it has gotten so expensive, and it's outrageous. We need some type of control. We need some type of system where everybody can be insured. Like I had mentioned before, we are the wealthiest country in the world. It should be a right, not a privilege, to have insurance.
To learn more about LSP's healthcare policy work, go to www.landstewardshipproject.org. That's landstewardshipproject.org. You can also contact LSP organizer Paul Sobocinski at 507-342-2323. That's Paul Sobocinski at 507-342-2323. If you have comments or suggestions about this podcast, contact me, Brian DeVore, at bdevore@landstewardshipproject.org. Or you can call 612-722-6377. Thanks to Laura Borgendale, a Western Minnesota musician, for Ear to the Ground's theme music. And a special thank you to all of Land Stewardship Project's members who make initiatives such as this podcast possible. If you're not a member, visit landstewardshipproject.org to learn how you can join LSP. Thanks for listening.